Researchers in Oklahoma may have developed a pill to help combat hearing loss. According to KFOR News Channel 4 in Oklahoma, the pill works when taken shortly after an extremely loud noise exposure, and it substantially reduces your hearing loss by rapidly repairing the inner ear tissues and nerve endings that lead to permanent hearing loss. According to the Hearing Loss Association of America, in age-related hearing loss, changes in the inner ear cause a slow but steady hearing loss. The loss may be mild or severe, and it's always permanent. About 20% of adults in the United States, 48 million, report some degree of hearing loss. At age 65, 1 out of 3 people have hearing loss. Mindy Pollitt, audiology specialist at Lake Ear, Nose, and Throat, explains the different types of hearing loss.
There are 3 types of hearing loss. There's nerve damage, which is called sensory neural hearing loss, and that's just where the little hair cells in your inner ear or the nerve is damaged. So there's nothing that can be done to fix that. We can aid it with a hearing aid, but we can't fix it. There's conductive hearing loss, which is something medically is going on in the middle ear that's not letting the signal pass through to get to the hearing nerve. So sometimes that can be treated medically, whether it's fluid or infection, or even if the bones of the middle ear are not working, there's surgeries that can be done to fix that. And then the third type is called mixed loss, and it just means that it's a mix of both the nerve damage and the conductive. So there's a component of that loss that might be fixed medically, but you're still going to have some hearing loss from the nerve damage. We recommend people come in every 2 years for a hearing test unless they say that there's a problem in between, because then it could be a medical problem, so they should go ahead and come in. A hearing test consists of 3 components. There's air conduction, which is through headphones or insert headphones. Speech testing, where we have them repeat words back to us. And bone conduction, which actually stimulates the hearing nerve. So all 3 of those components are required by law so that we can tell what type of hearing loss you have. What we're finding is that younger people now need to come in for baseline hearing tests. It used to be, 60, 65, but if you're 50, 55 and you feel like you're starting to struggle, you should come in and let us test you so we can have a comparison. So if you feel like it's changed, we know what type of change there's been. A lot of times it's a family member that sends the patient in, but if the patient's, honest with themselves, they'll notice that when they're in a group setting, they start to not include themselves in the conversations because they're not quite hearing everything and they don't want to be embarrassed by answering incorrectly. So they just kind of withdraw from the conversation. We always tell people, just stop and look at your surroundings. How often am I having to ask people to repeat themselves, or how often am I not hearing it so I don't answer? Those are kind of the signs that maybe you need to start getting a hearing test so we can see where you're at.
The audiology specialist will be at the Women's Expo on the Village's polo field if you'd like to stop by and learn more about the latest in hearing aid technology. You can find more information about the audiology services available at Lake ENT when you click on the hearing loss story link icon on our homepage, yourhometownhealth.com.